And just let me know when you are able to see this, so I'll know that you can see it. So right now I'm in PGI Chandigarh. In Chandigarh, is about northwest of New Delhi, 220 kilometers. And this is right in the foothills of Himalayas. Now we are having a really cold winter. It's quite foggy out here, and I have multiple things lined up for the day. But a good way to start is to start talking to you about this important faculty development program. My first disclaimer is that I'm not I'm not a I'm not a medical practitioner. A lot of people mistake my introduction as a neurologist. I'm a scientist like many of you. I'm a nature lover, and I love to experiment with new facts and with new hypotheses, which is my job as a scientist. So I'm also a visiting professor to SVASA, one of the leading yoga universities in our country, and of course, probably the largest in the world also. I will try to keep my focus and discussion on how I evolved as a scientist from, as I mentioned in the beginning, from a biomarker and animal modeler to yoga and meditation researcher. So this is going to be the first slide. And this tells you, like any other research lab, we also wanted to look at all the aspects of biology and research. As you would do in pharmacy, in your labs, you would need an animal model to work on, so you can screen some herbs and drugs. So we have an animal model development program. Of course, since we are in neuroscience, we focus on neurodegenerative disorders, or disorders of the brain, disorders of the retina. And like you may have, some of you may be working in a medical institute like I do. So then we have access to these large rush of patients. And so we are able to get their biofluids, and we can test new biomarkers. So uh, we have also got a biomarker discovery program, which basically means we try to, correlate what we find as potential markers of the disease, and how they correlate and associate with the onset of disease or progression of the disease. So we have a very active biomarker discovery program, and whatever we discover is in the range of angiogenesis and neurogenesis cocktail of markers, and try to put them in the animal model, generate a disease phenotype, and then rescue that in the process of drug discovery. And this is what has been happening in last 20 years. And then if these biomarkers are really useful and can be used for the other patients, we need to obviously translate that into useful kit or a product. So at one time, and not anymore, we had a very viable and a sustainable molecular diagnostic program. But now we encourage our students to take up these markers, patent them, and then take it further into market. So this is another aspect. And then we have been working in a large span of my existence in this lab for the field of neural or the stem cell manipulation program, because we are trying to rescue the phenotypes introduced into the animal model. We would like to have a recourse or a resolution of the disease symptoms in the animal. And before we, as you know, we first use the animal model, and then we go to the phase 1, 2, 3 clinical trials. So we have this stem cell manipulation program as an adjunct to our discovery process. And so we have lineage negative stem cells. We have worked with ciliary epithelial derived from the aborted fetuses kind of stem cells. And then we test them in the dishes and in the animal models, and see if they can be usefully employed for rescue of the function, which is lost artificially in the animal model of that disease. So we've been working in all this using what is also very familiar with you and not with other people, is the GLP, the good lab practices. Incidentally, we've been recognized by Quality Council of India in 2014 and 16 as the only research lab which is adherent to the principles of quality assurance, making data verifiable, auditable, archivable, and backtraceable. And this is our passion. And this is what, when I came back to India, I wanted to give this back to my students and my to also stir myself up that we need to bring in the quality data such that this data is reproducible. Because when I worked in US, a lot of colleagues back in 2001 to 3 used to say that this data from India, China, maybe I don't know how much you have to believe that data. This was a general impression which inspired me to bring this GLP component into all that I'm talking to you about, whether it's animal model, whether it's biomarker discovery, whether it is diagnostics. Now we don't do that anymore. Whether it is stem cell manipulation, we try to make SOPs for that, data recording sheets for that. We ensure that our instruments are calibrated. We make sure that the master scheduling is done and data is archived in fireproof cabinets so that we treat our data as a as currency notes, as a bank would look into or treasure its currency in a fireproof cabinet. That is basically what is GLP. So this is how the boat of this research or the this vehicle was running for 15 years, and we were continuing to work and answer questions. And because of the generous introduction that you listened to, I remained still a very unsatisfied researcher, and I wanted to do more, as many of you may want to do. And I didn't, and we did not have faculty development programs somehow, or I missed it. It was pretty much self-guided, and it was pretty much learn from traveling and collaboration. But I really wish I had some faculty development program which I could listen to like this. So why I'm telling you this is because on a self exploration mode, with all the nice CV that Dr. Brijesh talked about, I remained unsatisfied because I knew I could not come up with a drug for Alzheimer's. I knew in the heart of my heart, no matter how many awards I won, no matter how many countries I traveled, no matter how many students I mentored for PhD, I remained unsatisfied in not being able to get a treatment for a non-communicable or a lifestyle disorder, or at least to tell someone how to remain happy, a happy scientist with a good relationship between student and a teacher. I remained unsatisfied. So then also unsatisfied by these figures. These are figures of the prevalence and incidence of the various non-communicable diseases. Until the COVID came, we all thought we were more confronted with problems of diabetes, at least in the middle class and up. We were not so much pervaded by or attacked by the TB or plague or polio. They were all eradicated. Maybe TB was coming and going, and some viruses would come. But most of the focus used to be on non-communicable, like diabetes, heart attack, stroke were coming like a monster. And we always complained, if you look at the graph below, we always complained of the budgets. Oh, this government is not giving enough attention to health. Look at the budget of India is shrinking as compared to the other countries. We always complained of that. Those are WHO figures, maybe about 3 or 4 years back. But you know what? I want you to bring your attention to the fact that a lot of this budget was not appropriately allocated, even though the overall GDP, in my own way, in my own interpretation, even though it was not that high as many people complained, but I thought it was not even allocated to lifestyle diseases or towards preventive healthcare or towards our feeling good about ourselves. All that about happiness, about joyfulness, about mindfulness. No matter what you did, whatever research we produced, how happy we were doing it, how good was the journey. There was not much investment into yoga, mindfulness, or community-based public health outreach programs to prevent a disease at the pre-disease state. So there was nothing so. Uh, I was not so stunned basically. I was not so stunned that the budget is so low. I always remained stunned by how much was being allocated to preventive healthcare. And I want you to also rethink, not necessarily agree with me, but at least think of, and I make you think more by showing you this movie. A lot of you may have seen this. Maybe if you have seen, just type yes in chat box. This is Sui Dhaga, a movie that is a story of a couple, uh, running pillar to post, a low middle class family, not having enough money to pay for the bypass surgery or a angioplasty of their mother, who is going to be, who was having a heart problem, which probably could be preventable. Of course, there are diseases of the heart which may not be preventable, lifestyle modification, but there are those category of diseases of the heart that can be prevented. So the story beautifully illustrates of how much burden of healthcare, how it impacts the low middle class or even middle class or even rich people also. Sometimes if you have diseases that could have been prevented just by being happy, just by having good lifestyle, and having very good interpersonal, social, emotional relationships. And all of that, you may, for as pharmacy faculty and students, maybe a few of you know how, why am I saying that, but a few of you who doubt this, which is very good, I will show you some data of how prevention can play a lead role in our lives as faculties. Now, this is a story. By storytelling, I give my own example of how we began with, creating animal models for degenerative diseases of the brain, of the retina, and then as I showed you earlier also, of how we carried out the human studies with collaboration of our colleagues in the clinics who would sit and examine patients and give them treatment. So we would take our little blood and CSF using all the ethical approvals, and then look for them, what the markers were. And we continued doing that for 15 years. The world has done that for last 100, 200 years. And then, of course, slowly we were stunned, and it became more and more visible that all of this discovery was not leading to real treatment. And if at all it was so very expensive, and it was so much determined by the pharmaceutics and pharma companies, that we had hardly any time to ourselves, to self-healing. So we slowly began to venture into this beautiful field of yoga. And not because this was something new, not at all. This has been for ages, 3,000 years, 3000 BC, maybe 5,000 years back. Ayurveda talks of an Ayurvedic framework of health and wellness. Traditional Chinese medicine came a little later or at the same time. They talked of similar concepts of well being. It's not that they lived early, they lived less. Some of them lived a really good, healthy, long life, even though there were diseases that were communicable. The medicine as it existed 500 BC, the Greek medicine was there. Slowly, homeopathy evolved, as you can see in this chart. Hydrotherapy, for those who have seen anyone having problems of muscular dystrophy, cannot move around. So they provide a framework of hydrotherapy where you can walk around in the water with your limbs, and it is so comforting. Something that is not even found in our primary healthcare institutes today, or even hospitals. Do you know, do you recall having seen hydrotherapy in the hospital that you visited with your parents or yourself? I don't think so. So slowly, organic farming, people became more and more aware of the adulteration in foods, the pesticides. So this is an evolution graph of how the wellness approach began to evolve in time. So my reason for getting into this field was neither this evolutionary tree and nor the failed clinical trials, but as an individual person who was not well developed as a faculty, because I was unsatisfied, as I mentioned. I wanted to do something which could be more useful, more scientific, and less cognitively biased against uh, self-healing approaches. So then I come to the definition of what yoga is. Actually, is eight-limb path as is prescribed by the Patanjali Sutras or the Maharishi Patanjali several thousands of years back. He gave the concept of eight-limb path, and which is characterized by, if I could divide these eight, I will read them for you. It is, but before I read that, I can describe what yoga is. Yoga is basically defined by a number of people in different countries. It's basically a union of the body and the mind, or the dynamic nature of the mind and the body, how much we can go to the extent of harmonizing it. Some people in the spiritual sense may have their own interpretations of yoga being a tool to integrate our own consciousness with the cosmic superconsciousness. Others would talk of it as an experience of living in the moment, in present moment. But theoretically, and this is, I think, central to our dialogue today, central to our faculty development program, of what these eight paths are. And the theoretical aspect of yoga tells this is divided into the first two. Yamas and niyamas are basically social and moral principles of our um, existence, or our behavior, or our position in the society, of how we do not try to look at others, try to steal other stuff, whether it's pleasurism, whether it is material things, and how we keep ourselves clean and sanitized is also prescribed in Yama Niyama as a kind of modified life, a disciplined life, in which you are conscious of yourself, and in brief, in not interfering in someone's independence, and stealing is one aspect to it, and all the moral and the social codes, they are there in the yamas in Yama. There are five each in Yama, and five each in Niyama, and there are subcategories. Uh, Please Google and see that later, and if you want, you can do that now as I speak. And then the third is the asanas. Asanas are, so the yama niyama are, I think, also essential for our own development, our personality development, our faculty development. We must go into detail and look that up. But what we know of yoga is, unfortunately, the asana part only, the physical, or the postures, whether they are standing postures, sitting postures, lying down postures, prone postures, meditative posture is also there. So this is the asana. But a lot of Western world, and even in India, mistake asana as the yoga itself, which is not so at all, completely not. And although there are, Hatyo Pradipika talks about the various kinds of asanas, and the asanas, they also, research papers are there that show that they have somatopsychic effects. So if you do a certain asana, if you bend in a certain way, and you have a focus on a certain part of the body, or even if you do your warm-up exercises, there are perturbations going into the brain, certain areas in the brain. So people say that they argue that it has a somatopsychic effects also. And of course, psychosomatic effects are very well known, which I will come to later. But talking more of asanas, they are sort of prepare your body to become contemplative and meditative, which will follow in the eight limbs. Asanas have also been a fancy for the people into sports, and therefore recently government has even included asanas as a sports. You might have heard of news that yoga is part of sports, but it's not the whole yoga actually. Only the asana part has been proposed to be included in the sports, and I look at it as a very positive development, because not only it gives up your body, but it engages the younger kids, the school kids, into yoga, which they otherwise find very boring. So that is why it has now been included in the sports. I think there must have been more reasons than just what I said. Other reasons could be bringing the beauty of asanas into uh, different games, football, hockey, you know, or swimming. So if you are a good asana freak, if you can do really good asanas, you're flexible, you can stretch well, and if you, as I mentioned, have some somatopsychic effects also, maybe you're more agile also. So a lot of field and activity. It's an activity. It is a field of research. So from a yama niyama asana, let's move to the pranayamas. Is more of breathing techniques. How you can, now having established your asana and physically fit, uh, can you engage yourself in a regulated breathing? So those are those regulatory breathing techniques, ranging from different yoga schools that have come up. Sudarshan Kriya for art of living, Isha Kriya from the Sadgurus, and there could be Kapalbhati is not really a pranayam, but it is a kriya, and I will not delve into the more details of the pre-yoga kriyas, which are sometimes considered wrongly synonymous with yoga. But anyway, keeping the topic alive, the pranayama is basically the breathing techniques, and they empower you to do asanas, to sit in asanas longer, and they also provide you a good parasympathetic hold on yourself. The fright and fear, if that is too much, it may create problem. Even the COVID-19 related IL-6 exacerbation or inflammatory response, if it is too much, it may be damaging. So the parasympathetic response is essential to our own existence and our calmness in the mind. Some people even talk of yoga in not really some people. In fact, Patanjali Sutra talks of, as some of you may know, yoga. They say there's a verse, there's a Sanskrit phrase that goes like this: Yogaschit vritti nirodha. So it basically means that yoga helps to silence the perturbations of the mind, and therefore I feel that pranayama or the breathing techniques actually help you in doing so. It helps you to keep the perturbations or fluctuations in the mind in order by simple, slow breathing. Breathings can be clavicular breathing, it could be belly breathing, and there are so many kinds of breathing. And alom vilom is another aspect of pranayam, and belly breathing, as I mentioned. And I already mentioned the Art of Living, Sudarshan Kriya, and Sadhguru's Isha Kriya. And of course, government now has its own protocols, which I will come to later. So what does this breathing technique help you to achieve? It helps you to actually introspect, regulate your mind, as I said, the perturbations in the mind, but it also makes you go inward. The process of going inward is so difficult when you are always confronted with things that disturb you, that distract you, noises, visions, views, distractions are all around you. So how would you go inside? So this is how, from the Yaman Yamas, Asana, Pranayama, and then Pratyahar. After the fifth step out of 8, essentially helps you, facilitates the process of inward journey. And then the last 3, the Dharana, Dhyan, Samadhi, are another goal of yoga. In fact, the goal of yoga is meditation, as I mentioned. And this process of inward journey can be formalized by dharana, that helps you to focus, and dhyan, which sustains that focus. As you can see, that is like a cascade. And samadhi, which makes you enter into an effortless. It is no more effortful. It is not driven by pranayama anymore or by an inward pratyahara, but it becomes effortless and so difficult to achieve. So it is believed by many yogis and no longer confirmed, no, not confirmed by the current modern literature so far, to the best of my knowledge, helps you to effortlessly, seamlessly, they say, treat or at least prevent some of the major disorders. So now I think I've spent 3-4 minutes on this important aspect of the faculty development, which is nothing. If you take the word yoga out of it, it is a philosophical construct by which you can become a good, upright, moral, honest, healthy person at mind, at body, at emotion, and on every aspect of your personality. And if this is balanced, then you're in the process of achieving the goals of yoga. And what if I were to be proven wrong? People will have to do studies to see if any of these limbs of yoga do not bring preventive healthcare. So I haven't seen much research into people using any of these techniques to disprove that they are harmful for human beings. But I will show you a lot of data of how these are actually useful to human beings. So I'm going to use a COVID scenario as a model to make you understand, because all of you are an encyclopedia. All of us are an encyclopedia of COVID. We know what is COVID-19, what are coronaviruses, where they came from, how they jumped into humans, how many people have died into millions, 60 millions, and so many are dying. We all know, everybody, all of us pretty much know what is COVID. In the history of Earth, I doubt if anybody knew of a scientific topic of a single virus so much as we know. We know it affects our lungs. We know it has a stigma. It used to have. We started with fear. We know of lockdowns. We know of countries. So I will use this as a means to explain to you with evidence how we can contribute more toward rescuing from the anxiety and stress of coronavirus, and also how we can contribute to the society as the our as pharmacy faculty from the corona perspective. These are some figures that I just mentioned. The Indian figures of mortality were argued as below the average, the global average, but nevertheless it is there, and still 30 people are getting positive every day, and I think 400-500 are dying, still dying, even if even as we enter into the last quarter of the last 1 year. So there is a pre-COVID fear, and there is when you are getting COVID, you are really in tantrums, and then post-COVID, you hear of problems. You have heard of people getting reinfection and lung problems that have persisted long enough. So we did a survey of what was how COVID was. This is still unpublished. It is in the revision. Hopefully, it will get published somewhere. Actually, it's in revision in a very good journal. So we basically showed that COVID has had a lot of effect on mental attributes. It increased anxiety, it increased depression, and not only in the healthy volunteers, more so in the comorbids, the diabetics and the uh, hypertensives, and also the elderly. So they were most affected. Not only that, even the frontliners were affected. So this study we have shown that not only they were affected, but their coping skills was not good enough. So that means if we have knowledge, if we are healthy, and we know we are anxious, and we know we are stressed, and if we don't do anything about it, it's so miserable. I mean, if you are, pharmacy, you are teaching every day, doing research every day, but you can't help yourself with the research. What's the point? So their coping skills are really not enough. That is what we found. And this study is not just the only one that we did. So many people tried to look at the effect of yoga because almost everybody was stressed, and it was untreatable. There was no cure. And today also we don't know vaccine, whether it would be of use, whether it will have side effects, who will get it first, what will the plan this year or next year. Something, even if it succeeds, what if COVID-20 comes? So people have started, there's a surge of research activity in the field of yoga, employing it as if it is called as yoga. Some people call it by mindfulness, others may call it by meditation. You can read it here. Some applying it for geriatric population, others for stress management, and others are still doing meta-analysis. But this is mostly reviews and meta-analysis. Now we are now actually trying to study now as we speak, and the program is underway, looking at the effect of a certain breathing technique in the COVID positive patients and the recovered, as well as a third category of healthcare workers. So why are people jumping into more and more yoga research and more mindfulness research? Well, is it that the people realize that even a communicable disease, which no one ever thought beyond antibiotics and anti-contagion drugs, that a mindfulness technique may rescue it? Is it just because it is untreatable that we have nowhere to go? Or is it just that anxiety and stress that is weighing on us so much that we need to do something about it? Is the mental epidemic on its way? Is it the next epidemic? So this is happening as I go through other slides. You can see more and more people doing research in meditation with relation to as yoga as an adjunctive treatment in SARS infection. Very little data used to exist with relation to immunity and yoga, but now this is beginning to come up, and we will see more data. Some people often argue of yoga as having a Hindu tradition or something like that. But I would like to inform that this is a secular approach. It predates Hinduism. And therefore, a lot of people like to now use the word for the benefit of patients, for the benefit of the entire globe, a new terminology called the mind-body medicine. And this mind-body medicine is essentially uh, the approach towards life by integrating the self with the body with the mind, and as it says, the consciousness with the subconsciousness, as you may imagine, and in a way, in a means to regulate your attention. It's a systematic, as it reads out in the slide, systematic mental focus on particular aspects of inner or outer experience. So when you are aware of that moment, and that is when the mind body connect is at its best. And when that is at its best, this is said that it may enhance immunity. It is hypothesized that it will put the real good growth factors into place. It may impact the what is called the HPA axis. I mentioned parasympathetic response, but all of this I will show you through data. That not before I delve a little more in detail about a couple of comorbid conditions. Let me use hypertension. Let me use diabetes. These two are the most, these are the conditions which make you most vulnerable to COVID. So I will use these as a example to narrate the usefulness of meditation and yoga in these, because eventually many of you may be hypertensives, a few of you may be diabetics, and obviously more vulnerable than the others, and more maybe perhaps more afraid of what's going to happen to you when you venture into a family which is COVID infected or recovered. So this is a point that comes to our mind, and we are also faculty. We have to do teaching, we have to do research, and how can we be productive if we are not healthy, and if we are not less stressed? If we are always stressed, not only it will reduce our immunity, and if we also are not able to go out, do exercise, and if we also keep pumping in all kinds of foods without being conscious of the ill effects of bad diet and lack of exercise, obviously we will be more vulnerable to infections. And therefore, it's very important for us to lead a regulated life, more so for the hypertensive and the diabetics. As you can read, that this helps the mind-body medicine, or the what I just said is also traditionally known as yoga. It helps you to regulate your sleep habits and patterns. So a lot of research where these circadian rhythms have been shown to be corrected by regular yoga practice. And not only that, it also helps you regulate body weight, because even the obese people are more prone to COVID-19. And not only that, it also completely disturbs your metabolism. If you are eating at wrong times, waking up at a wrong time, and not doing any exercise, and also it impacts your mind and your feeling about yourself, and how positive you are about yourself. All these aspects of heart rate to immunity to your sleeping habits are impacted and apparently corrected by mind body framework, or a yoga framework. Let's focus on hypertension. What is hypertension? Is an abnormal blood pressure that can almost kill a heart or damage a brain. It's called stroke. If it is a heart, it's called cardiovascular disease. Those are the figures for India in 2016 alone. So it's a big problem. And of course, it makes you susceptible to COVID-19. A lot of us, in fact, in my colleagues are not even knowing they are hypertensive, and so a lot of us may have subclinical hypertension undetected, and the symptoms may range. All the symptoms that may range from fatigue to vomiting to confusion, and of course there are so many causes. Partly because your parents had it, or if you're taking too much salt intake, if you're taking alcohol, smoking, these could be possible causes. And stress is the topmost, as you can see. So I will qualify this slide by the next one, which you will really like. But not before I tell you the risks. The risks, what are the risks of this problem of hypertension? It may cause stroke and heart attack, as I mentioned. It may even damage your kidney. So there is apparently a lot of impact on the health and wellness if we do not have a good blood pressure. Now, look at this slide. It's an important health problem of India, of course, not just West. Half of the population doesn't even know that they are hypertensive. Even you, if you just after this talk or now grab a BP machine and try to measure your BP maybe thrice a day for 3 days, and not just once somewhere when your BP may be normal or abnormal, will not be a good sample. Or see a doctor who can diagnose an hypertension for you. You will be amazed that a lot of you, at least half of you, may turn out to be hypertensive if you're 40 plus, or maybe one third of it. And those who are aware they're hypertensive, 60 to 80% can't do anything about. Even with drugs, it will not help. So first, you do not know you're hypertensive. Second, if you know you are taking treatment is not working for about one third of you, or a little more than one third for some of you. And those who are treated and they do not still, even if they take off the risk factors, they may still persist with this. So some of them may not take medications. Some of them who are taking medication may not benefit. So what to do, where to go, where to find a solution for this? And as faculties, we have to write research papers, we have to teach our students, and we have to accommodate many more requests from our directors and our heads of the departments. And all that sometimes causes us to raise our blood pressure. And medication will not be an answer to this. So what do we do? This is actually, we have to tease out the risk factors that are linked to this hypertension. So one is risk factor modification. What are the risks? I enumerated them for you. You can easily take off your smoking, alcohol. You can keep the fat diets out. You can start doing exercises. If very, very necessary, you can, if the doctor prescribes, you can start taking antihypertensives, of course. But all of this can be very easily done by just a simple 30-minute of yoga exercise when you cannot go out for swimming or jogging, or if it is limited and restricted, what you can do within a room and without even paying for a gym or paying for getting a trainer for you, or driving place to a different field ground, to a field or to a sports complex to play badminton. If you don't want to do that, you can still be at home and do yoga. Now, slowly coming to why yoga and why this meditation, why this mindfulness. It is well believed now there are two ways yoga can actually exert its effect. So one is the vagal stimulation. Now, vagal stimulation increases the heart rate variability and baro effect sensitivity. It is shown by a lot of research papers, randomized controlled trial, that the inflammatory cytokines, the bad cytokines, like IL-6, they may come down after practice of yoga. And even the heart rate, and look at the blood pressure, is also very nicely influenced and moderated by the practice of yoga. That is the vagal stimulation aspect. It's one pathway. If you look below, there is another pathway that some scientists have argued as the parasympathetic activation that may lead to reduced stress, and parasympathetic activation may also reduce the activation of sympathoadrenal, or the HPA axis that I just mentioned. But what does it all do? These two pathways converge to improving the insulin sensitivity. So those who are pre-diabetic or diabetic may have better receptivity to the insulin being secreted in the body. Or those who are diabetic, if the insulin is not acting, lots of case reports and research papers have shown that they may empower or increase the action or the activity of insulin by just increasing the sensitivity. Even the visceral adiposity, which may be one of the reasons for insulin uh, resistance, could also be improved. And of course, the obvious impact that I find on my mood, my sleep, is yoga. If I finish my day by pranayama on my bed before I sleep, I get very good speed, very good sleep, and a great mood. I get up with a great mood and so fresh. It's also known, research has shown that it reduces the oxidative stress and it improves the endothelial function. So therefore, this together will help in the cardiovascular improvement of reduction in the risk factors for cardiovascular disease or hypertension. So this is the pathway. You may like to take a picture or just remember that this is how we take, but I will show you more data to convince you, because you won't be convinced so easily. And a lot of people do not even know that such good analysis and data has been already published of the effect of yoga on the on its anti-hypertensive effect. Now, this study was a major study. It was done in Mayo. It was published in Mayo, and what basically it tells about it has shown that after 3 practical sessions of yoga per week, there was a reduction in the blood pressure, and it was a significant reduction in about the that's a meta-analysis of about 3,517 trials of the middle-aged people. As I get more and more into the depths of yoga and its impact on health, a lot of you may be thinking, what kind of yoga, how much to do yoga, and who will make you do yoga, and all kinds of questions. So these 2-3 papers I'm going to just tell you of not so protocolized or standardized protocol, but disparate yoga exercises combined to give an intervention. And then later I will tell you what we are doing in our country, what is happening as we speak on the aspect of standardization of yoga protocols. But before we go there, you'll be struck by this paper that yoga may have effect right on the genes, on the pathways that regulate immune pathways, on metabolic pathways. And this was a study done by Dr. Bhasin from Harvard. He's the first author, published in JACM, in which he carried out transcriptome analysis in the peripheral blood mononuclear cells in about, I can't see the number of people here, but if you can go and read that, and a considerable number of patients, presumably. And he showed that these immune regulatory pathways and metabolic pathways are affected. And also the cardiovascular and circadian rhythms are affected. And molecules like NF-kappa B, VEGF, and insulin were those that were positively affected. So this study got published, and let's look at more a role of yoga in self-regulation and the regulation of arterial hypertension. This is a randomized control trial. Also showed that the arterial hypertension patients were also impacted by simple mindfulness techniques and interventions. And therefore, yoga seems to have a pretty strong effect on standard lifestyle modification of blood pressure in pre-hypertensives. When we talk of these papers after papers, if you go back to what I started with, was pre-disease state and preventive healthcare. How much can we make impact by our lifestyle change, be it exercise, be it yoga, be it just dietary changes, or our being happy? All of that is useful only if we are able to bring the changes in a sustained fashion. And all of this makes sense if we can do it early, before disease sets in, or a pre-disease state. So let me tell you just to give you an example. I will name a few pre-disease states so you will get a handle on what I'm speaking. For example, diabetes. And when there is diabetes, what is a pre-disease state? It's pre-diabetes. If it is cancer, in certain types of cancers, you can pick them as pre-cancers also. Some lesions will come up, either in oral cancer or in breast cancer. Then there is a pre-Alzheimer disease entity also, and that's called MCI. So Alzheimer disease, causes cognitive and memory losses. And the pre-Alzheimer is MCI, mild cognitive impairment. Similarly, pre-stroke. Pre-stroke, there is TIA. So TIA is transient ischemic attack. That may happen just before stroke and may go unnoticed, and it may yet increase the chances of getting a stroke. I will use another disease such as wet AMD. It's a disease of the eye, age-related macular degeneration. The wet form is really bad. The choriocapillaries may leak into the what is called the retinal pigment epithelium, and by spatio-temporal occlusion cause blindness. So can it be avoided? Yes, it can be avoided by dry AMD, which is not wet AMD. And if we can make an impact at the dry AMD form, it's a pre-disease state. Pre-disease state basically means that if we can make an impact on yoga, if we can bring lifestyle changes, then we can probably attain a better lifestyle or a better disease outcome, prevent the disease right there. And these papers tell us about how it can bring the change in the diseases that are used that are important for metabolism, the diseases, the factors that are important for insulin sensitivity, the factors are affected by yoga that are involved in neovascularization or new blood vessel formation. So it seems that there is enough evidence ranging from out in the outside home yoga practice or even home-based yoga program has all shown a good impact on blood pressure and all these pre-disease states, on which more research needs to be done. Of course, more research needs to be done on how much yoga can halt the conversion of pre-disease to a full disease state. And I invite you to take that up as as a research design. I will change gears here and tell you that all the uh, people who want evidence for a drug or a vaccine obviously seek evidence for yoga and lifestyle. And without evidence, we will be only half convinced. But even if we have evidence, research has shown, unless you have experienced yoga and meditation and a good lifestyle, you will not know the difference, no matter how many research papers you read. So this study was done just to examine the impact of reading all the good data about yoga versus experiencing yoga and prescribing it. Among the study was done on the healthcare workers, the residents, the doctors, and they found that the more the people experienced it, regardless of the theoretical and the scientific confirmatory evidence, the more was the possibility of their prescribing it to their patient and on applying it on themselves. So from all this data that I discussed and evolution of my research focus into yoga and the importance it has on our faculty development, I'm now shifting gear towards experiencing it as the first hand evidence. That's the most important thing. And this is also shown up in this research article of how many doctors will prescribe integrative medicine, some people call it yoga prescription, some may call it uh, as an alternative medicine, of one of which could be yoga, and is actually the driving aspect of the alternative medicine. So the experience actually enabled them and pushed them to prescribe it to the others. Now look at another aspect. The genetic counselor, they have a very tough time. Genetic diseases have no cure, and it's such a problem. They experience something called compassion fatigue, and they have less work engagement. The empathy burns out because every day they see this. Some of them are thalassemics, some of them are muscular dystrophy patients. They know they will never recover. They will be never. There is no treatment for them. So there is a compassion fatigue. How many times you will be compassionate again? So it's a unique phenomenon. And these group of researchers basically assessed the compassion fatigue and burnout in the genetic counselors with and without mindfulness programs or the yoga interventions. And they found that it significantly improved the impact that was having on the genetic counselors burnout when they did yoga, when they did or adopted mindfulness technique. They increased their empathy, it reduced their compassion fatigue. And I think similar fatigue we face as teachers and researchers, doing the same thing again and again, just talking to our students, if we are in a lab, doing lab meetings, if we are following GLP, doing the same document profiling every day, checking a thesis, attending ethical committee meetings. So we also get burnt out sometimes. We are repeating the same thing again and again. So this research tells us that if we are doing some mindfulness programs, also as encapsulated in the eight limb yoga process that I showed to you, this can significantly alter the boredom or the burnout and bring more joy and beauty. So I think as a faculty development process, this is an essential part of the faculty development. And I am glad that you have all use this as a tool, and you identified and you're conscious of the importance of whether it's called heartfulness or it is called by any name, Sudarshan Kriya, or just yoga or Hatha Yoga or asanas combined with the breathing techniques, all of them can greatly rejuvenate and reinvigorate your energies and reduce your boredom. If you just do a 30-minute or even 15 minutes of breathing exercise, and all this data points that out. Now I'm going to, to take a more scientific dive into the field, and maybe some of you, as productive faculty members and students, may consider taking it as one of your research objective or as a research project, or combine it with your, as make it as an adjunct to the clinical trials you are doing. Even the clinical trials, or the vaccine trials, they are done with and without, controlled, randomized controlled fashion, or in, an exploratory fashion, single double blind fashion. But even the trial output, this is my hypothesis, I haven't seen papers. If you are doing those kind of studies, of course barring the animal studies, but at least with the human studies, if you add on the mindfulness component, will the clinical trial output increase? This is a question. It's a hypothesis. I'm leaving you with that. So, from this disparate yoga protocol that I showed you and the theoretical framework of yoga that I showed you, we're now moving towards the importance and the intervention of standardized yoga protocols. So, government has come up with diabetic yoga protocol. It's a 1 hour protocol combining the standing, the sitting, the lying down, and the prone position, and the meditative aspects of pretty much combining all 8 limbs of yoga into what is called the diabetic yoga. But this was spearheaded by SVASA, University of Yoga in Bengaluru, with Dr. H.R. Nagendra and Dr. R. Nagaratna in a 63 district across the country, pan-India study design. And they found astounding data. It was published in 2 dozens, maybe more than a dozen papers, maybe almost 2 dozen papers. And the protocol was developed by this great team following what is called the Delphi protocol. A need for a protocol is obviously important. The experts included yoga masters, endocrinologists, scientists, and people from all walks of life, and primarily all the yoga schools. They sat together on different rounds and agreed that yes, diabetic yoga protocol may be the way out. Or they also came out with common yoga protocol, and which is practiced on June 21st, the International Day of Yoga. So now we have a protocol. You're all into pharmacy, you need an active constituent, you need a standardized extract to test on the animals, or wherever, whenever drugs come, and is scaled up for the commercialization, or for a scaled up translation. So we have such a protocol here now. And this protocol can be used for faculty development also, because a large number of us who've crossed 40, 50 years of age are more and more susceptible to diabetes and hypertension, as I mentioned, because of the nature of our work, and more so in the COVID-19, when we are not moving around so much, eating lots of, we're waking up and we're from our, I'm, for example, sitting and you're also sitting, we're not doing much activity. Even in a conference, we would stand up, go take a water, come back, or we take a class, walk around our campus. We're not doing that. So even more important that we consider adopting these protocols into our lives, into our faculty development programs. This is a beautiful paper we came out from the intervention of diabetic yoga protocol in the pre-diabetics. Now it's well known that the pre-diabetics may have a certain rate of conversion into fully blown diabetes. So by the intervention of this common yoga, the diabetic yoga protocol in these bunch of 16,000 people across the country, we found and reported that the conversion of the pre-diabetics to diabetes was halted. And the important thing that was actually the cardinal, more central to this halt, was the reduction in perceived stress and depression. So essentially we captured the stress data and depression data before the intervention and after the intervention, 3 months of intervention for 1 hour each, as I mentioned, the common yoga, the diabetic yoga protocol. So the take-home message was that not just exercise, but it is the reduction in the stress and depression. It is our ability to handle coping. What how we handle stress, how we cope with it. That is more central to even driving or not driving the metabolic diseases to its fully blown state. So probably this is the first paper where by intervention at the stress and the depression level, we can claim that the halt of disease happened. So this came out as a letter after many submissions and resubmissions. When the editor finally agreed, he said, "Okay, you make a small report, write a letter to editor." So he didn't carry it as original report, but the data speaks louder and louder of the importance of stress and anxiety and depression on our health outcomes, on us as our faculty also. When you're not healthy, obviously we cannot be good teachers. We can't do good research if we are not healthy. So how can we keep the mindfulness out of faculty development programs? We did more research on a similar protocol in women, and we found it affects the lipid, the adipose tissue, and we looked at the radiological liver, fatty liver, as well as the biochemical changes. Although the liver changes analyzed by radiology were not significant, but yes, the HbA1c level, which captures the 3 months of, it's sort of a marker for a semi marker for diabetes, was altered positively by the yoga intervention, diabetic yoga intervention. Now, those who are interested and are more used to seeing molecular data, we also looked at common yoga protocol practiced on June 21st. So, diabetic yoga protocol, I told you, you please note it down. You can Google it, read it, learn it, and if you go to just Google Yoga Scholars PGIMER, you can find it there. We ran a 225-day of continuous integrative health education series with the active voluntary activity of our students who showed all these protocols there. They're all there live. You can go to the archive and see them there. Now, those of us who are, more accustomed to seeing data at the molecular level, here's the here's the paper we just came out, the effect of common yoga protocol. And what you showed was the common yoga protocol can be, it is a protocol that's a 45-minute yoga protocol. It does not have a Surya Namaskar, but it has all the sitting, standing, prana, and lying asanas and the meditative aspect. And it is able to regulate, we showed, it impacts the angiogenin levels and partly also the VEGF and BDNF. Now, those of you who are not familiar, BDNF is a good growth factor for the brain, VEGF for the new blood vessel formation involved in angiogenesis. And angiogenesis is a sister molecule, which is both involved in neurogenesis as well as angiogenesis. And those who are already aware, you may know that neurogenesis and angiogenesis go hand in hand. So if there is neurogenesis, there may be angiogenesis partaking. If there is angiogenesis in the brain, the neurogenesis may be happening simultaneously. So these are the molecules which participate in the process of new blood vessel formation in the brain as well as in the body. And more so, BDNF plays a more active role in, of course, brain. And it's already well known that these molecules have a direct relation to stem cell trafficking. It's responsible for our cognitive abilities, memory enhancement, and stuff like that. So this is the first evidence of common yoga protocol practiced on June 21st that can impact the molecules that are central to angiogenesis and neurogenesis. And so I am, as you may have noticed, progressed from physiological changes to changes at the fat level to more at the stress level, and now I'm taking you right at the molecular level. So yoga is not just there for those who believe in it. It's all science, and we have protocols to test that. And I welcome you to untest that if you would. Why not? We at least take out a study, carry out a control trial between diabetic yoga protocol and common yoga protocol, and maybe put in a bunch of cytokines and apoptotic factors growth factors, some brain-derived factors, maybe amyloid beta, some microRNAs, and see what the effects are. And some of you who handle animals can also go to animal. I will leave you with some ideas of, as a part of this faculty development, of your intellectual inputs you can give to this program. But before I go there, this is just to summarize what I just said. These were pre and post effects. And as you can see, the angiogenin and VEGF level went up after 3 months of, 1 month of common yoga. This is a 1 month of common yoga protocol data. Now, if you recall, in between I mentioned Sudarshan Kriya as an art of living. Now, this data I show you from is from the art of living, people who spearheaded this program into high altitude. And how do we test? How do we test the breathing techniques? Now, this is the pranayama aspect, although it's combined with a little bit of asanas also. If it helps regain the lost oxygen, measured as SpO2, when we take a flight to high altitude with depleted oxygen supplies, such as Ladakh. This studies was done in Ladakh with depleted oxygen, a 4-day meditation retreat with Sudarshan Kriya as the central component of that 4-day protocol. People ate the same thing, they slept at the same time, and there were no minimal confounding factors, if not none. And also very relevant to COVID-19 because we see the people who are severely affected with COVID have depleted oxygen. So can this technique, this breathing technique rescue the lost PO2 levels? This is the case in high altitude. Can this be emulated and tested in COVID-19? I don't know, but the data seems to suggest that it can. And then I bring in another aspect to this data. The data is pre-post, and more importantly, this is based on psychometric characteristics. Now, for the faculty listening, when we analyze our data, some people may benefit from yoga and others may not benefit. Some people benefit from a certain drug and others don't. It is common experience, as this is also common experience that all the vaccines don't work equally in all, and that is why the concept of precision medicine and the personalized medicine came up. Now, Ayurveda, which I shown you in the wellness scheme, provides a beautiful Ayurvedic framework, though limited to some critics, does provide a Kapha Vata Pitta framework by which you can categorize the influence on the biochemical changes, Kapha wise, Vata wise, Pitta wise. So I think if I do not forget, if I recall correctly, the changes were seen, better changes, although superior PO2 rescue was seen in these high altitude non-acclimatized subjects, more in the Vata Prakriti than in the Kapha Prakriti. So that's the important thing. So do people respond in a different way to yoga? It's an open question for you to take up as a research subject. When I speak to you now, you may be obviously responding in a different way. Some may be responding positively, others may be questioning, but at least we have a means to test and then form our beliefs in the value of yoga. And then I also brought in the experience of yoga as well. But for people who are going to be suddenly mobilized to Ladakh for war, or people who are there in COVID ICUs, where is the solution unless we bring in the Ayurvedic framework to their rescue? What I mean is, our current medical healthcare system completely lacks the Ayurvedic framework of clinical categorization of individuals, at least in the Prakriti framework. And at least for these PO2 level rescue, we found Vata Prakriti were superior in responding to Sudarshan Kriya Yoga as compared to the Kapha Prakriti. Now, this is published in Brain and Behavior, published from Harvard, well peer-reviewed and rigorous scientific peer review and cycles of revision has taken place, and this is how we published it. You can even take it further to your cell culture experiments on animals. So we are now doing this of our PhD student, girl called Kanupriya is now basically culturing some neuronal cell lines and then taking out the sera from these practitioners versus non-practitioners and seeing What is the MTTSA telling us? These are these are motor neuron cell line, NSC34. This is preliminary data. But now, for those who are handling animals, you test your drugs, you test your pharmaceutics, you make different sham control, treatment control, dose control. We can use these same models for different diseases as a part of our uh, testing and looking for more robust evidence of yoga or mindfulness or even exercise. It could be just endurance exercise, and just see how the blood products, whether they are stem cell or they are just sera or just plasma, if they are put in animal model of a disease or an injury model, how much it can rescue. How does the comparison, is there a comparative efficacy of your drug that you're testing today or herb you're testing today versus those who have practiced yoga, their blood into that animal model. This is just an idea. I bring in a design for you using Swiss albino mice, where a similar study has been proposed to fashion the dynamics of animal model research, untouched by yoga research till date across the world. No one has done it. We are now getting into it using the same paradigm of animal models, different groups, as you can see, and same molecules are being tested at different time points using different paraphernalia of molecular and animal model research, and the same groups, as I mentioned, the sham group, the injury group, and the intervention you are doing, whatever drug or stem cell in this case, plus your yoga arm or yoga related blood intervention into these models. These are ideas for you, all of you listening. These are some study designs I'm throwing to you to take up. Now look at this design. You can do this kind of a study on pregnant women, give them a certain mindfulness technique, see before and after. Now what we are doing, we are actually getting the cord blood from pregnant women who have undergone yoga versus those who haven't, and look at the cord blood derived stem cell yield, and then take those stem cells isolated from the pregnant women having practiced yoga into the animal model of injury, and see if the injury can be rescued by this yoga practitioner derived blood or stem cell versus those who haven't practiced. So we are basically trying to answer the same question using the molecular framework or animal model framework to see if this really meets the eye. What is actually happening at the human level before and after intervention, or at the stress level before and after, is it really bringing the changes at the cellular level or not? The same group of mice, I show you here an amyloid beta injection group, one which is used for Alzheimer's disease creation. You put amyloid beta intrahippocampally and obliterate the memories and test them in Morris water maze. They will take more time to reach the submerged platform, and whether that's amount of time it takes to reach the submerged platform, can we reduce it by putting blood extracts from the yoga group versus usual care group? And what are the markers which are affected? Are they markers related to apoptosis? Are these markers related to neurotrophic factors? Are these related to cell survival? So all that can be done and fashioned into the same style. Well, I am not alone thinking about it. Well, for the yoga, maybe I'm alone, but recently in Science, a paper came out where blood factors were transferred from the young mice who were doing treadmill in their cages, and when this was transplanted into old mice, their neurogenesis and their cognitive and the behavioral changes were behavioral deficits were rescued, and there was increased neurogenesis. So if the blood factors can transfer the good effects of an exercised mice, of course the mice cannot do yoga. So when they did exercise, the good effects of that exercised mice, when transplanted into old mice, they were recovered, rescued. There was improved neurogenesis and improved memory function and cognition. Isn't that interesting? This came later. Our lab has been thinking and getting regulatory approvals for last 2-3 years. We have one project, as I mentioned, in the pregnancy. domain, the other at the prisoner's domain, and because they eat the same food, and the confounding factors we believe are minimal. Some people have gone further. You know what they have done? They have tried to capture meditation in the mouse. Not that mice can do meditation, but the features of EEG that resemble or are characteristic features of meditation were recapitulated in mice when a certain laser of certain intensity was shown on its eyes. So they apparently had the same EEG changes as which resembled those men who had undergone a meditation. So they proposed this as a model for meditation in mice. Well, meditation is, of course, a more conscious, more complex, and more higher form of activity. I'm not saying that this is. I'm not saying uh, by any measure of argument claiming that you can study meditation in mice. All I'm saying is that a lot can be studied by this model, at least because it captures some of the parameters of meditation found to be altered when humans meditate. So this is published in PNAS, and you can read that up. I will not go there. Let me stop here and take questions and ask the organizers how much time I have.
Yes, ma'am. Actually, sir, it's 11:30, but it's up to you. Like our second speaker can uh, postpone a bit if you are in flow. Like it's okay.
Well, I will just go into telling and I'm also taking questions in between. What I will do, request you to, and through this medium, ask and anybody wants to.
Sir, we have some questions. If you
Okay.
want, I can read it out, or we'll take it at the last. Whatever you say.
Okay, then what I will do, I will quickly go through 3, 4 slides like this one. This is a huge study on the diabetic yoga protocol, which I just mentioned, and then take the questions. So this is a study in which we showed the tension is really high in India, diabetes is high in India, more people who are hypertensive. Among the diabetics, pre-diabetes has less hypertension. So the both are hypertension, diabetes are all intertwined with each other, and as they are make you more prone. Oh, did I log out? Can you? My computer
Yes, sir.
tell.
Sir, we can hear you.
Okay, I don't know why my computer said I'm logged out. You can hear me, right?
Yes, sir. Yes.
Okay, great. So I'll carry on with this figures. I will skip, and this is common yoga protocol, and this is what we did International Day of Yoga when the Honorable Prime Minister visited India. We just thought this was a great, and especially for those who want to do more research, need more sample. Yoga provides us that access to large numbers. So we just did that. These were people queuing up for 1 month to get a coupon to do yoga with the Honorable Prime Minister, and we used it as an opportunity with regulatory approvals and the administration's approval to get before and after analysis done. And we found that the cognitive abilities improved, at least in 5 individuals that we analyzed, and we showed all the good blood pressure changes, weight, and BMI all improved in this common yoga protocol. And this is some pictures from Ansarovar. We did the same study of Sudarshan Kriya and we showed improved changes. And this is what I mentioned to you. The Vata Prakriti individuals were better, they responded better to yoga intervention or Sudarshan Kriya, 4-day intervention. Better mental well-being, less anxiety, improved glucose because when you go up unacclimatized, your glucose suddenly drops. That was improved. The Oxford Happiness Questionnaire showed some improve. All were the significant. This was for the Vata Prakriti. The Pitta Prakriti had similar changes: good cholesterol, improved cholesterol, reduction in the stress markers. But the Kapha, look at the Kapha Prakriti individuals that I was just telling you, are hardly moved. No changes in the mental aspects of the parameters, but only changes were there in the cholesterol level. So there is a differential change in different prakriti-wise changes in the way the yoga may impact different people in different ways. So I will skip this. This is just heart rate variability measures, and I think I will end with this particular um, cartoon proposing and getting your views on how important today is for us to build institutions to reimagine our health framework in India, which is more cost effective It encompasses not just modern medicine, but also the Ayurveda and yoga based research, evidence based research, prescriptions, and protocols for the benefit of patients. If not replacing medications, at least as an adjunct to at least the non communicable diseases, at least the untreatable diseases, and if possible, also the clinical trials, as I just mentioned, and bringing in the beauty of the evidence I showed through molecular biology, the preclinical investigation through the animal model that I proposed, and of course the ayurgenomic aspect. Where what I did not tell you that the prakriti based changes, the kapha vat. When I say prakriti, I mean kapha vat and pith. They have been shown by very good high impact factor journals to have a genetic basis, and that is called ayurgenomics. So if we can defragment the various aspects of healthcare into one model, hospital under one umbrella, practicing all pathies together hand in hand, it will not only make it cost effective, but from the research point of view, we'll be able to have comparative effectiveness trials done within the same umbrella, within the same institution, and be able to come out with answers to outstanding questions such as HCQ works better for COVID-19 or ashwagandha. We cannot have this today because within the same institution, we do not have professors of Ayurveda and professor of medicine working hand in hand. And hence, we can never ever compare in a scientifically rigorous manner of the efficacy of HCQ or remdesivir or any anti-COVID-19 drug versus ashwagandha, which has an equal, if not more, number of publications in the field. With this, I will thank my beautiful lab, an excellent team of students who include some alumni who are no longer with us, some who are still working with us, who have been working daily, day in and day out, not only in their animal model work, biomarker and cell culture work, but also practicing yoga every day to keep themselves updated, rejuvenated, and very, very productive, publishing at least uh, 10 to 12 papers every year. I think this is the key, we feel is the key to productivity, to happiness, and good student teacher relationship. Thank you very much for that opportunity, and I'll be very happy to take questions.